Good evening and welcome to one and all. My name is Sudhir. I'm a zonal sales manager for Glenmark Respiratory Division. And today, in behalf of Glenmark Respiratory Division, I take an opportunity to welcome our honorable speaker of the event, Dr. CHSR Varaprasad. Dr. CHSR Varaprasad has done his MD Pediatric in the year 2000 and he has also done his post-graduation program in pediatric nutrition from Boston. And doctor is a consultant pediatrician in SV Childcare Clinic, which is there in Malkajgiri, Hyderabad. Doctor is having 20 years of experience in clinical pediatric practice. And above this, doctor also runs charity pediatric clinic on the name of his father every Thursday morning at SV Childcare Clinic in Malkajgiri, Hyderabad. This is a small introduction of our speaker today. And with this, I welcome and hand over the session to Dr. Varaprasad.
Okay, can I start?
Yes, sir.
Yeah.
Yes, sir.
Right. Screen sharing. You start screen sharing?
Yeah, you can share the screen, sir.
Okay, am I audible?
Yes, sir. Your voice is audible, sir.
Yeah.
Yes.
Yes. Okay, right. Thank you. Good evening to all the doctors who are logged in to this webinar. And I am Dr. Vara Prasad, practicing pediatrician from Malkajgiri. And I want to give you a small disclaimer. This web presentation will be focusing on doctors who are running the clinic and not for the hospital setup. So any doctors, please don't be disappointed who are running the hospitals, because my focus is mainly on the clinic practice. And some of the information in this presentation have been taken from CDC and WHO regulations.
Sorry to interrupt, but if you can just hold the mic a little. If you can hold the mic a little up, because the voice is not coming that loud.
Yeah. Now can you hear me?
Yes.
Can you hear me?
Yes, sir.
Yeah. The views in this presentation are based on my clinical and practical experience. Right? Can you hear me?
Yes, sir. Your voice is clear, sir.
Right. Yeah. Coming to today's topic, how to manage clinics during COVID-19 pandemic, a need of the hour. This is a topic which focuses on our day-to-day practice, and we are supposed to take every precaution in order to run our clinic in a safe way. So let us have a small introduction. So recently, the World Health Organization has given a statement that COVID-19 is going to be a part and parcel of our life. Just like we have other friends like dengue fever, swine flu, and HIV. So we are living with them. So we have to get adjusted ourselves for this COVID-19 also. And so far, as a pediatricians, we have to get adjusted and get prepared and start living with COVID-19, probably for coming 2 to 3 years with utmost precautions. And we have to wait for the vaccination to come so that we have to be extra careful until the vaccine comes into the picture. So what are the measures you need to prepare for your clinics? First, you should get yourself prepared. Hello.
Hello, sir. Yes.
Yeah. Today, I would like to categorize the talk into 4 categories. First, getting yourself prepared. As a doctor, we should be prepared for ourselves. We should get prepared ourselves about running the clinic. And the second thing, educating the staff. And then greeting and welcoming the patient. And preparing your clinic. So these are the four categories which I want to stress on today. Next. Now, mode of transmission of COVID-19. Initially, before going to the picture in proper, first you should get yourself educated as a doctor. So mainly the corona is respiratory droplets, as you all know. And it also gets transmitted by touching or by direct contact through contaminated surfaces or objects indirectly. Next slide, please. And getting yourself prepared. So, as you all know, today the symptoms of COVID-19, every child may not be the same presentation. Some present with fever, cough, shortness of breath, chills, muscle pains, headache, sore throat, and loss of taste or smell. These are the common presentations which we know. And there are atypical symptoms also like conjunctival congestion, hemoptysis, diarrhea, and loss of smell and respiratory distress, headache, chills, and nausea and vomiting. And before we start after knowing the mode of transmission and after knowing the signs and symptoms, what we should do. So you have entered your cabin and now you're getting yourself prepared to see the patient. So what you're doing first supposed to do is first have a thorough hand rub. So hand rub technique according to CDC and WHO guidelines, I think so all of you know. I would prefer personally to hand wash with soap and water than the sanitizer. If you have adequate water, please use hand wash with soap and by interlocking your fingers and both on the dorsal side and palmar side and rubbing the thumbs, and after hand wash you can wear your PPE kit. So what is this PPE kit? PPE kit contains a gown, a mask, goggles of face shield, and gloves. So there are two types of PPE kits we know. One is a reusable PPE kit, and the second thing is a usable one, reusable one, and a disposable one. So as a in our clinics, I would like you to wear a reusable ones and leave the disposable ones to the persons or to the doctors who are treating the COVID-19 patients. So coming to the gown part, this can be a fabric with a cloth, made up of cloth, and try to keep 3 gowns in your clinic. The first one which you are wearing, the second one you would have gone for laundry, and the third one for the spare. So you can interchange daily this gown. And once you have hand washed, you can wear your gown and then have again another hand wash and then wear a mask or respirator and then goggles. Please mind, once you wear your gown, you're supposed to hand wash your hands properly, because before touching your face parts, because you all know coronavirus spreads when we inhale through our mouth, through nose, or through conjunctiva. So we have to take utmost care when we are going to touch our face. So we have to wear the masks after the hand wash, then the goggles, and at the last the gloves. So in gloves we have two types of gloves: the nitrile gloves and the latex gloves. It depends upon your wish. But the thing is, nitrile gloves are preferable because they can withstand the chemicals, whereas the latex gloves, they are allergic to some individuals. So nitrile gloves are not so allergic. So the WHO and CDC recommends nitrile gloves. But even if you are not allergic to latex gloves, you can wear latex gloves. So now you are prepared. As a doctor, now you can see in this picture, this PP is purely for a health personnel, not for a frontline COVID person, for the doctor. So he's wearing a gown here. He's not wearing the PPE suit. And this is, once you wear the PPE kit, please, you should also know how to remove the PPE kit. So How to remove the PPE kit is, first remove your gloves. Why you should remove the gloves first? That I will tell you, because your gloves is the most contaminated part. Because you'll be seeing so many of patients and you'll be touching so many surfaces, your pen, your files and all. So gloves is the most contaminated part. Remove the gloves first and remove the gown, and then have a proper hand wash, and then again your hands should, after hand wash only, your hand should go near to your face. Then perform a hand hygiene, remove the face shields and goggles, remove the respirator face mask, and perform hand hygiene again. Can we reuse the PPE? As I've already told you, there are two types of PPE. One is the reusable one and one is the disposable one. So cloth items like gowns, cloth masks should preferably wash with soap and hot water. And if you have an autoclave machine, you can autoclave your gowns. Coming to face shields and goggles, immerse in 0.5% of sodium hypochlorite, or you can clean with them with clean liquid soap. And again, for reuse of N95 mask, suppose if your OP is busy and if you feel that a person has had bouts of cough or you had a sneeze in your OP and your OP was busy, I would recommend you to discard the masks, especially the N95 or a surgical mask. But there are some places where you can reuse the N95 mask if you are just vaccinated, and there are not much fever cases, cold cough. You can reuse it after the fourth day. So for after removing the face mask, that is N95 mask, simply dry it in safe open air, and you can use it on the fourth day of reuse. And before this, there is one more topic based on hydroxychloroquine prophylaxis. This is a controversial one, but I just wanted to people know what is this hydroxychloroquine prophylaxis. Although WHO and other centers have not recommended it, but some of the doctors and some of the webinars which I have attended have just touched this topic. And you also, if you are interested, you can have a small knowledge about this hydroxychloroquine. It is used to prevent, it is used as a prophylaxis against coronavirus, and the dosage is 400 mg twice a day on day one, and then 400 mg weekly until you get a vaccine. But please be aware that this has a lot of side effects on the cardiac problem. So when you want to take a hydroxychloroquine, the age of the doctor should, if the age of the doctor is above 50 years, he should have a permission of a cardiologist. Make it sure you should have a permission with a cardiologist. If you are a diabetic, if you are a coronary heart disease patient, or if you are above 50 years, please take the permission of the cardiologist and we can start the hydroxychloroquine. But this is a controversial, and I cannot tell you that it should be used. Now you are prepared. Now you are prepared with your gown. Now you are prepared with your knowledge about COVID-19. You know how the symptoms are spreading, and you know how how your the uses of all your goggles, your gloves, and all. So let us. And before going to educate your staff, I want to just tell you your health is first priority. Give first priority to your health. So if you have symptoms of cold, cough, and fever, please avoid going to the clinic and take care of your health first. Please keep this in mind. And then educating the staff. So the same thing repeats because you are now aware about all the symptoms and signs of COVID and all the hand rub techniques and all about PPE. So teach them about the basic symptoms of COVID-19. Show them the technique of hand wash. Tell them the use of face mask, gloves, goggles, and PPE, and speak the necessity of social distancing between each patient and avoid touching unnecessary surfaces. This is about the educating the staff, and educate them about the online appointments also. You should encourage them to give online appointments, and you should also encourage them to be aware of the patient's symptoms online itself, so that they can sort out in the later appointments. So planning, how are you going to plan your appointments? Try to promote phone appointments. This is very, very important because we know as a clinicians, people come directly to us without giving any appointment, without taking any appointments. So when they come directly to us, there is a chance of overcrowding in our outpatient department, especially our waiting areas. Those who are having single chamber and single waiting area, they have many problems with the patients who will be waiting. It will be leading to a crowd. So to avoid the crowd, we have to promote phone appointments. At least those pediatricians who don't have the habit of phone appointments, at least from today, you please try to promote phone appointments. That will save you a lot of time for you and for your patients, and it will avoid overcrowding, and it will be a future difference for you to communicate in the later part of your practice. Then patients who have taken appointment should stick to the allotted slot. This has to be informed to the patient by your receptionist. Your receptionist should be telling to the patient that if she gives a slot at 10 o'clock in the morning, the patient should come at 10 o'clock. If she comes at 10:30, take like that appointment is cancelled. She should tell in such a way so that patient will be sticking to their slot. And divide the clinic hours into three parts. The first part of your clinic hour, suppose you are running your clinic for 3 hours, the first part of the clinic hour, please cater it to the vaccination section, because the vaccinations will be getting all small babies, and your clinic is neatly disinfectant. So when you get a vaccination patient, you will be assuming that your clinic is nicely disinfected so that you will not have any problems. The second thing is give appointments for the patients who are not having fever. That is the second hour. And the third hour, patients who are having the fever. So divide the clinic hours into three parts. These all things should be planned by your receptionist. Once you educate your receptionist, you see that they give the appointments in such a way that they will not come for the fever patients and the vaccination patients doesn't coincide one to one. And once the patient comes into your chamber, once the patient comes into the waiting area, sort out the fever patients. For example, as we know, we have already given the appointments and the patients are coming on time. But unfortunately or fortunately, we get some direct patients who are having high fevers and they will not be waiting. So try to isolate those patients who have come directly into a separate chamber if you have. Otherwise, ask them to stand outside your clinic. And avoid calling regular patients for general checkups and other queries. Instead, promote video consultations. Then what about teleconsultation? Try to be connected to your patient through phone, WhatsApp, or video calling. So now what I am doing is, if I'm getting a patient with fever, cold, cough, I'm trying to do a video calling and and I'm telling them to review after 3 days. So in such a way that I can avoid direct contact with the patient. And even a general patient, suppose a patient tells that my child has a wound on the head, I want to show you. For the such type of patients also, you can encourage teleconsultations. And while practicing teleconsultation, do it only for your regular known patient with their previous history and disease pattern. Because a new patient, you may not know his mentality. So try to promote a regular video consultation only to your known patient. This is very much important. Why? Because you have to also take the medical legal aspects in view. So keeping the medical legal aspects in view, try to give video consultations to your regular patients only, and preserve the e-prescriptions, images and reports which you need to refer them in future to avoid medical legal consultation, medical legal issues. So now you have finished the getting yourself prepared. Now your staff is educated. Now you are greeting and welcoming the patient. So the patient is coming into your chamber. So what are you, how you are receiving the patient? That is very important. So follow single patient and single attendant policy. Suppose if three attenders come with one patient, please ask the other attenders to stay outside your clinic and ask only single patient and single attender to enter your clinic. Excuse me. Then face mask. All the patients who are coming into your cabin, into your clinic, should wear a face mask. And no carry bags, handbags, or shoes. Leave them at the entrance of your clinic only. This is very, very important because these people can carry a lot of virus in these things. So please don't allow carry bags, handbags, or shoes into your clinic premises. And if only required, the files are allowed. If only required, don't encourage even files also. But if you have an immunization record, or if they want to show you, if you don't have a digitalized prescriptions or digitalized software in your clinic, then you can ask them to get only the immunization files. And once you hand sanitize them at the entrance, before they enter the clinic, tell them not to touch any surfaces and maintain social distancing in waiting area. It depends upon your waiting area. Suppose if you have a small waiting area, you can ask one or two patients to come inside. If you have a big waiting area which can accommodate around 10 or 20 patients, then you can ask around 2 to 3 patients to come inside. And in the waiting area, if you have 20 chairs, just make it now into 5 chairs, because you should allow only 4 to 5 patients in your waiting area if you have a big one. If you have a small waiting area, don't allow more than 2 or 3 patients. And the distance between each waiting area, between each patient, should be minimum of 6 feet distance. If it is possible, maintain even 10 feet, no problem. But a minimum of 6 feet distance is necessary. And try to limit 6 patients in an hour. Why? Because again, as I told you, you don't overcrowd your waiting area. And when you limit your patients as 6 patients in an hour, that is 10 minutes in an interval, that is good enough that one patient will be coming in and one patient will be exiting out. And if you have enough chairs to accommodate, maintain a distance of 3 to 6 feet distance between each patient, which I've already told you. And once the patient entered your waiting area, and if you have a single receptionist, try to make that receptionist to sit at the main entrance. That is very important. So once the patient enters, she has to close the main door. Otherwise, other patients will be entering as their like. So once the patient enters into the clinic, just the receptionist who is sitting at the entrance of the door should close the door and then check the vitals, check the weight, height, and temperature if needed. And types of thermometer available in the market are infrared thermometers, which are non-contact, tympanic thermometers, and mercury thermometers. But according to CDC, all these three are approved. But CDC insists on infrared thermometer, that is a non-contact thermometer. Whereas a tympanic thermometer, if you want to use a tympanic thermometer, you can just wipe it out with spirit or with alcohol rub, and then you can use to the next patient. Or you can dispose the cap and use a new cap. But for mercury thermometer, personally, I don't agree for a mercury thermometer, but you can prescribe to the patient and ask them to use for their personal use. And please don't entertain mercury thermometer, even though CDC has told that to use mercury thermometer, and after every use of mercury thermometer, you are supposed to disinfectant with either alcohol or with a soap water. So now the patient has come into the waiting area. Here you can take an important point. If your patient is an elderly patient and if the patient is cooperative, So ask that elderly patient to sit in the waiting area, and only ask the patient's father or mother or the attendant to enter your cabin. This by this you can limit the patient stay in your cabin. Okay, then take complete history of the patient, and next maintain maximum distance from attendant to yourself, if possible 6 feet if your cabin is small, or you can maintain still further distance depending upon your chamber. Once the patient, once you take the case history, the patient is allowed into the cabin. So now the patient has come into your cabin from the waiting area. If this is an elderly patient, and now make the patient to sit on the examination table, not sleep. Please make the patient to sit on the examination table if it is an elderly patient. And before and after the patient examination, try to disinfect the area which the patient have slept or sat. And depending upon the age of the patient, if your patient is very small, the mother can bring the child with them in the cabin, and then you can examine the patient keeping the child on the mother's lap. But try to be protected yourself with the headgear if possible. And please assume that all the patients who are coming to you are asymptomatic carriers. Please keep it in mind. So all patients, 85% of the children are asymptomatic carriers. So all patients may not be good patients, but they may be asymptomatic carriers. But you should keep it in mind that all patients who are coming to you might be an asymptomatic carriers. And precautions while examining the patient. So if the child comes with fever, cold, cough, or with respiratory distress or influenza-like illness like running nose, then be cautious. You should be double cautious while examining this patient. Avoid throat examination. Why? Because when you put the spatula in the throat, there is possibility of gag reflex. And the patient may cough, or the patient may throw some saliva on you, which can be contaminated. So according to CDC also, they have told us to avoid throat examination. Instead, try to use your clinical knowledge depending and palpating the jugulo-digastric lymph nodes for any enlargements. Try to auscultate the patient from the back. This is also to try to auscultate the patient from the back. Why? Again, to avoid face-to-face contact from the patient, so that if the patient sneezes or cough also, it doesn't sneeze in front of you. So you can auscultate the back. From the back, you can come to the front and auscultate the heart also. And pulse oximeter can be used to assess the severity of the respiratory distress. Suppose if a patient comes with an influenza-like illness, and if there is a severe respiratory distress, you need not put your stethoscope. You can just count the respiratory rate, and if you feel that there is respiratory distress, put the pulse oximeter. And if the pulse oximeter is showing less than 90, you can you can easily think that this is a patient with influenza-like illness. And if you want, you can treat them in the hospital, or if you want, you can refer to COVID-19 centers. But as a pediatricians, we should take utmost precautions while examining such type of patients, because these are the patients which we do not know. They may be a COVID or they may not be a COVID positive. And if you have this ILI type of picture, please notify your health authorities. And if you suspect COVID-19 also, you can notify your health authorities. Can we use nebulizers in the clinic? This is one debate, and please avoid nebulizers and instead encourage spacers. Why you should avoid nebulizers? Because when you are putting a nebulizer to the patient who is having cold, cough, or running nose, they have all possibilities of emitting aerosols in the clinic. And the person who is nearby, assuming that this child who is having nebulizer is an asymptomatic carrier, the other persons who are nearby can also be infected. So try to avoid nebulizers in the clinic unless otherwise it's urgent. If it is urgent also, try to nebulize it in the open area where there is plenty of ventilation. And please don't nebulize in your chambers. This is a take-home message. And in case if there is any need of nebulization, we have to use a separate tube and mask for each and every patient. But be careful that your nebulization machine should not be in your chamber. And if you have plenty of ventilation, you can nebulize it, and that too if in case of emergency only. And clean your stethoscope after each and every patient you examine. And once you have examined the patient in your chamber, now send the patient out. If it's an elderly patient, if it's a baby, obviously it will be with the mother, and then counsel the patient attender and prescribe the medications. If it is a vaccination, you can the mother can carry the baby inside, vaccinate the child. Before vaccination, please see that you hand sanitize every time. Even though you have the gloves, you are supposed to sanitize after each and every patient examination, before and after every patient examination. Then wash and sanitize your hands after examination of the patient, and please do not wear unnecessary accessories like watches, bracelets, and handbags. And encourage online payments. In case you receive cash, keep them in a cover and put them in a drawer for 48 to 72 hours. This I will tell you why. And then while leaving the clinic, have a proper hand wash. How long can this virus live on the surface? This is why I was telling you, when you have a cash, the virus lives on the paper for 24 hours. So that is why when you receive a cash, try to keep this cash in your drawer in the clinic itself. Don't carry it to your home. So after 24 to 48 hours, leave for 48 hours, and then you can take that cash back. And every day you put it in a cover and write a date on that, so that you will not be confused with daily routine cash response. And the aerosols, the virus stays for 3 hours. The cardboard, it stays for 24 hours. And plastics and stainless steels, it stays for 48 to 72 hours. And copper bottles, it stays for 4 hours. This is why frequent disinfection of high-touch surfaces is very important. And so now we have finished our patient. The patient has gone out, and now we have finished our clinic. We have seen the patient, and now sanitization. Coming to sanitization of the clinic. So how will you sanitize your clinic? Initially, that is before the starting of the clinic and after finishing the clinic. First, you have to dust mop with the normal brooms, sweep all the corners of the room. This is the dry mopping. And then the wet mopping. The wet mopping should be preferably with 1% sodium hypochlorite. This is the choice because this is a disinfectant which can kill coronavirus, and you can even sanitize with the detergents or with hot water sanitizers, and mop the areas every nook and corner. And sanitize the clinic with doorknobs, railings, tables, chairs, and other items which have to be disinfected frequently, because these are the surfaces which are frequently touched by the patients. And once you sanitize your areas, you have to sanitize your belongings like stethoscope, the thermometers, the PP cups, and the covers. These again with the alcohol rubs, or with the detergent to hot waters and sodium hypochlorites. Anything can be used depending upon the availability which you have, the disinfectant which you have. And guidelines for use of air conditioners. Can we use air conditioners? According to CDC, yes, you can use air conditioners, but it should be preferably between 27 to 30 degrees centigrade, or it can be between 24 also, provided your room is again ventilated. Please do not use air conditioners in a closed room. As you all know, air conditioner sucks the air from our room and again it condenses it. That means it cools the same air and again releases back into our room. As we think that air conditioners will not exhaust the air which is in the room. So we are not going to get a fresh air. This air which is in the room itself is getting reconditioned, recirculating. So there is every possibility of the virus recirculating it. So when you on the air conditioner, see that your windows are open and if possible, you can even open your doors so that you can get a fresh air inside. So do not close your cabin when your air conditioner is on. And in dry climates, do not allow relative humidity to fall below 40% and ensure adequate room ventilation and air circulation. And these are the types of sanitizers now we are getting in the market. Hand use sanitizer, then the pedal operated sanitizer, and the automatic dispenser sanitizer. Hand use sanitizer, I would prefer if you have 3 to 4 receptionists, one receptionist can carry the hand use sanitizer and sanitize the patients. But if you have a single receptionist, then I would prefer for an automatic dispenser sanitizer, even though it is costly affair. But and pedal operated sanitizer, I will not recommend because the children who come into our clinic, they just start playing with that pedal operated sanitizer and they start wasting our sanitizer. Now we should take this sanitizer as a bold one because it's we have to please, and one more point I want to highlight is please use sanitizer liberally. You should see that the patient's hands are washed both the sides. Don't put it as prasadam and tirtham. You should give them liberally so that their hands are wet properly. Don't confuse with the sanitizers. And now coming between the differences between sodium hypochlorite and bleaching powder. So normally we are using sodium hypochlorite. Why not bleaching powder? That is some questions which have been asked. So sodium hypochlorite is always available in liquid form, whereas the bleaching powder is available in solid form. And in one study, in one publication, it is noted that the pH of the sodium hypochlorite is 10. So it is alkaline pH. And the studies show that coronavirus will be killed at the pH of 9. That is why 1% sodium hypochlorite is used, not the alcohol or any other detergents for cleaning the floors. Whereas the bleaching powder, it is available in solid form and it is a salt, so its pH value is only 7. At this pH, some bacteria can be killed, but coronavirus cannot be killed with bleaching powder. So sodium hypochlorite is the choice for disinfection. 1% sodium hypochlorite is choice for disinfection of all your clinics. This I have to thank a mechanical engineer who has given me this input. And regarding to advantages of 1% sodium hypochlorite, I have already discussed. This is commonly used disinfectant for cleaning the floors, high touch surface areas, and it is used as disinfecting corridors, washrooms, cabins, etc. And due to its alkaline nature and the value of pH is 10, it is used to kill coronavirus. And I should thank Mr. Maheshwar, a mechanical IIT from Kharagpur, who has given me this input. And after disinfection, it is time to close your clinic and time to end my discussion. And before leaving to your home, please, before leaving the clinic, inform your family to keep the main door and washroom door open. And once you enter the house, keep all your belongings like wallet, watch, spectacles, mobile phones, and other gadgets in a tray and ask your family members to clean them with alcohol-based sanitizers and detergents and ask them to wash their hands once they clean these objects. And enter straight into the washroom and have a head shower and keep all the clothes to laundry. So take home messages in my talk is take care of your health first and your staff health first. This is very important. If you have cold cough, please do not enter the clinics. and use PPE. You can use reusable PPE because we are not dealing with COVID-19 patients. We are dealing with ILI like illness or assuming asymptomatic carriers. And avoid nebulizations and instead use spacers. And try to auscultate from posterior aspect of the patient if required only, and remove excess seating arrangements in your chamber, because the more seats you put in your chamber, the more likely to patient to sit. 2 or 3 patients can be sitting in your chamber. Even in your waiting area, try to remove excess seating. If you want in your waiting area to be allotted for only 2 patients, then only put only two chairs in the waiting area. Don't put more than 2 chairs. It depends upon the space in your waiting area. And disinfect the clinic at regular intervals. It can be at 3 hours or 4 hours, depending upon the busy the clinic is. And notify any suspect case of COVID-19 or influenza like illness to BMHO or birth portal centers. And follow the Panchasutras. Masks and goggles should be compulsory. Protect your face well. Please do not touch your hands, or do not touch your hands with the face. So let your hands be away from your face. Do not touch, even though by if you wear gloves, don't touch your face. Hand wash frequently and cover your cough and sneeze, which is important, and avoid crowding in the waiting areas, and encourage online appointments and video consultation, and encourage online payments also. And thank you and have a safe practice. And in this juncture, I would like to thank the doctors who have helped me in this preparing this and giving me some inputs, like Dr. Nirmala Cherupuri, who is the professor of Gandhi Hospital, and Dr. Sudhir Reddy, Dr. Yashwant Rao, Dr. Ambarish, and Dr. Preetham, and Dr. Maheshwar, who is a mechanical engineer, who has told me about the air conditioners and about the sodium hypochlorites. Thank you very much.
So thank you so much, sir. It was a great presentation, and we have got few questions in the chat box, which I invite Mr. Deepan to take it. Mr.
Yeah,
Deepan.
sir. Yeah, hi, sir. Sir, there are a couple of questions. Why shouldn't N95 be kept in sun? Please elaborate.
It should not be kept in the sun, please. It should not be kept in the sun. It should be left to the air. It should not be kept in the sun, and it should be at least a minimum of 3 days for the virus to be killed. As we know, the aerosols, the virus stays on the cloth not more than 72 hours. So after 72 hours, you can use the face mask once again. But I preferably not in the sun. You can just keep it in the shade, but into air or in a paper bag. That's enough.
So another question
Hope
is,
I have answered your question.
yeah. So another question is, any message regarding how to keep our clinic sterilized other than sodium hypochlorite, any UVC, ozone, etc.?
Yeah, ultraviolet. This one is there right now. The machines are coming, but the safety and the efficacy of those things are not yet proved. We have to. Still, there are on the trials only. But if you have those machines, I think so you can use it. But according to CDC guidelines, it is sodium hypochlorite solution only, and alcohol rubs or detergents. You can use detergents if you don't have sodium hypochlorite. Any soap or surf detergents, but not UVC. They are not mentioned in any CDC recommendations.
So another question is, how often should we sterilize the clinic once we start seeing patients?
Yeah, as I already told you, depending upon the busy of the clinic. If your clinic is very busy, you can sterilize every 2 hours or 3 hours. And clearly, I told you, vaccinations is the first hour, second hour is the non-fever patients, and the third hour is the fever patients. So during vaccination patients, already your clinic is you're set up with the sterilizations. So that time you need not have a frequent sterilization, but make sure that after every patient is vaccinated, you You wash your hands and you wash the surfaces of the area where the patient has slept, where you have vaccinated. That is very important. And if you have seen a fever patient, please see that the once you can disinfectant within every half an hour or 1 hour or 2 hours. It depends upon your clinical symptoms of the patient. How
Sir,
often?
another
Yeah.
question is N95 mask a must or surgical mask will also do?
Yeah, N95 mask is a must or surgical mask will also do. Yeah, a good question. N95 mask is a must if we are a health workers, because the advantage of wearing a N95 mask is it seals the whole of your nose and the mouth. N95 mask. Whereas a surgical mask, there are chances of opening and the air. If the patient sneezes or coughs in front of you, there are chances of inhaling the aerosols. So there are chances of you inhaling the aerosols. So N95 mask is a preferable one because it seals the entire mouth and nose area. So if you are a health worker, if you are treating the patient, N95 mask is a must. If you are a social worker or if you are just going for health campaigns, then you can go for a surgical mask. But in a clinic, if you are practicing pediatrician, please wear N95 mask. And the next question, do we
Yes.
need to change the gloves after each and every patient or just sanitize and change the bed sheet after vaccination of each child? So again, this is the same. After every patient, you need not sanitize you need not remove the gloves. Just rub it with the sanitizer, which is containing 70% alcohol. 70% alcohol, and according to CDC, they have given even 60% of the alcohol also. But use a branded sanitizers. Now in the market, we are getting lot of sanitizers which have a lot of impurities. So use the branded sanitizer which has 70% alcohols and
So another question is surgical
and
gown.
after each and every patient, after you finish each and every patient, you can just wash your hands and sanitize it. And another question is, which type of sanitizer should we use? As I told you, it is 70% alcohol is preferable. That's it. Next question, what about the wall mount fans and directions of the flow? So wall mount fans, definitely you can encourage, but I am telling you again, keep your windows open, windows well ventilated, your chamber door open, and if you have possibility, open the windows in your chamber, because even though you on your air conditioners or your fans, please don't congest your room. The purpose is we want the virus or the air to circulate in and out. We don't want the virus to circulate inside our rooms. That is the reason why we are telling to ventilate the rooms. To ventilate, open the rooms, open the windows, open the doors. Even though you on the air conditioners, fan also you can use, no problem. Next question: any plan of reusing N95 masks? Any plan of reusing N95 mask? Yeah, as I already told you, if your clinic is very busy or if you feel that the patient has coughed or sneezed without proper protection, please discard that N95 mask. If you feel that your today's clinic is less messy and you don't have much of cold cough cases, you can reuse that N95 mask depending upon the patient, according to the OPD busyness. And next question, each N95 mask, how many days can we use? Yeah, I told you, you can use for 70, after 72 hours, you can repeat it. So if you use today, you can reuse it on the fourth day. But max of 5 to 6 times you can use a N95 masks. That's it.
So I think all the questions is over in the chat box, but still if any doctor have any query, they can unmute themselves I think there one question has come.
So one question has come. What do we do? Whom do we inform of a suspect case?
Yeah, if you have a suspect case, you can inform the DMHO, that is Director of Medical of Health Services, or you can inform the birth portal, or you can inform the nearby COVID-19 centers, or you can log in. When you log in into your Google, there are help centers or notification centers in your Googles. So in your net, you can just take the phone numbers and you can inform them. That is why I'm telling you, please take phone appointments. In phone appointments, you will have all the contact numbers of the phone, and by this you can inform to your nearby health centers.
I think one more last question has come. How frequently to change body cover? How to sanitize them?
Yeah, body cover in sense, I told you, if it is a reusable gown, if it is a cloth gown, you please keep three in your place. One you putting on yourself, one is gone to the laundry, and the third one is for a spare. Suppose if the one is not dried up, you can use the third one. So try to keep three gowns, and each day after you have finished your clinic, please keep them for a laundry. Don't reuse it for next day or for next session also.
Another
Can we
question has come.
vaccinate a baby whose mother is COVID positive? Yeah, yeah, this is a good question. Yes, if mother is COVID positive, if we know that the mother is COVID positive, please withhold it. But if we don't know that the mother is COVID positive or a asymptomatic carrier, then we can vaccinate, considering that it is a normal patient. Separate room for vaccination and sick babies. Yeah, separate room for vaccinations. Yes, it is a must. That is what today our main intention is clinical practice. All clinics may not have separate rooms and two chambers or three chambers. Many of our doctors have single chamber and single waiting area. If you have a separate rooms, if you have two, three cabins, you can always use one cabin for vaccination and one cabin for fever patients. Can we see the child whose family member is positive? Can we see a child whose family member is positive? See, that is actually already the patient is COVID positive or the family members are COVID positive, but they should notify you that their family members are COVID positive. If you have a COVID positive patient's family members coming to you, if it is left to you, if you want to see, you can see. There is no hard and fast rule that you should not see. You can see, but protect yourself, gear yourself, and you can see the patient. There is no hard and fast rule that if it is a COVID positive case, you should not see. It's not a recommendation. You can see, but you should gear yourself with proper PPE. Are we done, Sudhir?
I think yes, sir. We are done. I think there's not much questions coming. Do we need to take a informed consent?
Yeah, there is again a controversy in this. See, actually, in the consent form, what we are going to take is the patient. I have seen a consent form. In that, what they have written is, I am aware of this problem. I am aware of the coronavirus, and I may acquire coronavirus when I come to this hospital. Even in spite of I coming to this clinic, if I get a coronavirus, the doctor is not responsible for me for coronavirus infection. This is the consent form which the patient has to sign. This is actually, if you want, you can take it, but this consent will not, medico-legally, it will not be justified in the court of law, because recently I have attended a webinar where a lawyer spoke it, where the lawyer spoke, and he was telling, if you want, you can take a consent, but this may not be valid a consent in the court of law. But still, it is a controversial, and I am not an authoritative for that. You can contact the legal advisors. Do we need a is autoclaving a clinical beneficial? Yeah, autoclaving, if you have an autoclave machine, you can autoclave, but if all the clinics doesn't have an autoclave, or if it is, or if you have an autoclave, definitely you can do it on autoclave, that is better. Otherwise, you can go for a wash with a detergent and dry it. Any other questions? I thank all the doctors who have logged in, and probably I would at least, if you would have benefited from one point from this webinar, I'll be helpful. It will be helpful for me, and it will be a great motivation for my next seminars. Advice for breastfeeding with corona positive. Yes, you can give breastfeeding, provided if the mother is corona positive also, you can give breastfeeding. But the mother should wear a face mask. That is very, very important. And before and after handling the baby, the mother should have a proper hand wash, and she can give breastfeeding. And frequently she should mop the surfaces where she has put the baby or where she has sat, and there is no controversy in breastfeeding in coronavirus mother, COVID mothers or positive mothers.
Thank you, Dr. Vara Prasad.
Thank you, Ramakant.
You have given us good information.
Hope.
Yeah, we are confident to attend the clinics now. Really.
Yeah. Probably you attend Moksha.
Thank you. Congratulations.
Any corrections you can please, any inputs you can please give also. There's no problem. Any other doctors, if you have any inputs, please, any suggestions, so that we can improve ourselves in our clinical practice. If anybody following any new practices, please let us know on this platform.
Right, sir. Sudhir ji?
Yes, Mr. Deepan.
I think,
the questions,
I think we have answered all the questions. Yes, I think we have answered all the questions. So, sir, on behalf of Glenmark, I think something has come. HCP has come, but nothing is written completely. So, sir, once again, on behalf of Glenmark Respicare, sir, I would like to thank you for your valuable time and for this wonderful session, sir. And sir, you have answered many questions and answers. It was a good discussion there, but in many new different thoughts and maybe many things the doctors had in mind, sir. So the doubts probably. And so thank you once again for giving us so many insights and learnings, because this is going to be very important for the entire medical fraternity. Post lockdown also, it's going to be very important, not only taking care of yourselves as doctors, but also treating and keeping the patients safe equally at the same time.
Thank you.
Yeah, and also thank you for a wonderful audience for being patient, having a patience listening. And thank you so much for providing Glenmark Respicare an opportunity to serve you on the academic interest. And Glenmark always would like to continue and serve you on the similar interest on the scientific grounds.
One more.
Yes, sir.
I thank the Glenmark people who has given me this opportunity to host this webinar, and I thank all the doctors who have who have listened to my talk patiently.
The pleasure is all ours, sir, to have you with us. And once again, with the folded hands, I would say thanks to each and every doctor who has attended this session, sir. Thank you so much.
Hope we have finished on time and we have started on time. Thank you very much.
Thank you so much.
Bye. Have a safe practice.
Sir, now we will close this, sir. Now you can leave that button. You can press that leave and the session will be closed.
Yeah.
Thank you so much, sir, once again.
Thank you, Sudhir.